quite harrowing. And I think what I want to do now is in the concluding remarks, take just 5 minutes just to touch on the other things that were mentioned today, give some thanks, and talk a little bit about Testicular Cancer Canada and what we do. So I mentioned my thanks and our thanks to the panelists. Our thanks as well to the presenters. Every 10 minutes I was telling Cheryl I learned more than I knew, the last 30 years of my life about testicular cancer. It felt like learning about the different surgical procedures and the benefits and the side effects of chemo and radiation, other therapies like testosterone replacement, and the sperm banking and the downsides to that, how it can be cost prohibitive. These are all, some of the things are more talked about more often, but some of them are not, and we need to consider all the facets when we're thinking about how we as a charity and as a medical community and as caregivers can best support those with testicular cancer. So other thank yous. Thank you to, of course, our presenters, our panelists. Thank you to the Princess Margaret Cancer Center, part of the University Health Network, one of the lead sponsors for today. Thank you to Elixir for hosting us. This is a great location. It was ideal for our needs. Thank you so much. To Events by Mary for her support. Thank you for for conferencing and the event planning. If you like this event, you may be interested in. I'm going to grab this now. You may be interested in another event that Elixir is hosting. It's a patient engagement forum. It's on Friday, May 9th. It's called For Me, With Me, and it's a chance again for patients to share stories. It's a forum for people touched by cancer generally, not just testicular cancer. There is literature on the table just behind where Drs. Power and Potvin are. And speaking of them, to the other people who've put so much work in behind the scenes, Dr. Power, the chair of our medical advisory committee. And to Cheryl Perry, the founder of our charity, who's put an enormous amount of work into this and whose passion inspires all of us every day. A little bit about Testicular Cancer Canada and what we do. So we are a registered charity. We're independent of hospitals and government. We work with them to the extent we can. Our ultimate vision is to one day see the elimination of the suffering caused by testicular cancer. On that same table behind you, there's a little bit of literature about us, including door hangers, which were part of a campaign we launched earlier this year, earlier last year. Has it been last year now? Oh my goodness. On checking yourself on body awareness generally. April is Testicular Cancer Awareness Month, and you might know this because of the excellent public service announcement recently produced for us by Crush Inc. It's been getting international recognition in the UK, in the US, Denmark, Romania. It's been on People and the Daily Mail out of the UK. If you haven't seen it, we encourage you to follow us on our social media channels through Facebook or through Twitter. Our Twitter handle is @Testicles Canada. You can just Google us and you'll find all kinds of information about us and the information that we're putting out. And on our website, which is testicularcancercanada.ca, it's also where you can find the portal to make donations if you'd like to support the cause. So thank you to everybody again who's here. Thank you to everybody who joined us online. And that wraps up today's events.